Okay, good afternoon, and welcome back to the Friday afternoon session of the 2024 Recent Advances in Medical Conference presented by the Orear Institute for Postgraduate Studies. My name is Kevin Punswick, and I will be serving as your afternoon moderator. So, like I said, I'm Kevin Punswick. I'm a board-certified family medicine physician practicing locally here in Gardner, Kansas, and I work for the University of Kansas Health Systems. I graduated from Truman State University with a BS in biology, attended KCU, Kansas City University of Medicine Biosciences, earning my doctorate in osteopathic medicine in 2006. Went on to complete a residency in family medicine at the Research Medical Center here in Kansas City, Missouri. Started practice soon thereafter at Olathe, and I'm in my 15th year of practice there. I have 6 children, and my wife and I live here in Overland Park. So this afternoon, we'll be hearing again from Dr. Richard Wadsworth. Dr. Richard Wadsworth is a psychiatrist and author of several books, including one titled The 9 Steps of Change. He completed his undergraduate studies at Brigham Young University in Idaho and received a degree in psychology there, a minor in marriage family studies. He earned his doctorate from medical school at the Pacific Northwest University of Health Sciences in Yakima, Washington, and he attended his residency in psychiatry at the University of Missouri in Columbia, Missouri. He's blessed to have one child for every day of the week, and also lives with his, as he says, beautiful and exquisite wife, McKenna. They've been married for 18 years. He works as a telehealth provider in Missouri and does inpatient telehealth medicine for psychiatry there, and also outpatient general psychiatry. He's a speaker of multiple places. He's been also present through the Epoch Times, the Daily Mail Newsweek, and also been a presenter on the Insider magazine. He's a social media influencer with over 300,000 online followers. He enjoys spending time with his family, archery, and martial arts. Please give a warm welcome to Dr. Richard Wadsworth, and he is going to be speaking on how to help someone with ADHD survive in a world not made for them. Welcome again.
Thank you. Well, ADHD is a controversial topic. I'll launch into something, a little bit of trivia. Does anybody know who Walter Freeman is? Raise your hand. Okay, we got one. All right, don't say. So in 1936, he performed a first of what became thousands of these surgeries, where he would take what appeared to be an ice pick, and without anesthesia would place it in the eye socket with a little tap, pass through the fragile bone there, and then with a few twirls and movements, he would lobotomize patients. And it was very popular and requested procedure. And behavioral health units would call him in, and he would just go down the line and just lobotomize every one of them. And there's even a case I was familiar with of a kid who had a lot of energy, and stepmom was, look, this kid's bouncing off the walls, called him in, and Walter Freeman performed a lobotomy on the kid for having a bit too much energy. This is very disturbing on lots of levels. Every so often in medicine, as physicians, as clinicians, as doctors, we need to kind of look at what we're doing and just make sure we don't repeat things like this, that we don't do this again, ever. And every so often we find that we do in one way or another, hopefully not on that level. I had a case recently, a rambunctious 7-year-old boy. He clearly had lots of energy, He was climbing around. He climbed up on the couch, and he kind of jumped off, and I'm on telehealth, so he walked up to the screen and kind of did this pat down of the screen for me, and and he was talking to his mom, and then he turned around, and he was playing with the wall, and he was all over the place. And and he had a diagnosis of ADHD, and they'd put him on some meds, and they'd maximized him, and then that wasn't working quite as well as they wanted, so they put him on risperidone. And she was saying, this isn't working as well as I'd like. I'd like you to maximize his dose of risperidone. And I had to pause for a moment and wonder, are we doing the right thing? And what do we do? This is a controversial topic. When I was in med school, one of my superiors, a doctor there, took me aside, and we were having a conversation, and they said, ADHD does not exist. It's just a condition that we give to lazy people. He said, look, I don't like to study either, but I do it anyways. People with ADHD are just lazy, and that's why they don't study harder. And at the time, they were my superior. I kind of kept my head down and was sort of worried about making any waves, didn't say anything. But I would like to talk about this subject, because if you get a big group of intelligent people together, they're going to disagree on this subject. Some are going to have, they're going to agree with this doctor. Some are going to be far on the other side. You're going to have everything in between. But I think it's clear that there are some questions that are worth asking and discussing, and I will try my best to address some of these questions. One point someone made is, look, something like 10% of the population has got this diagnosis now, and some people say it could be high as 20%. Does that even qualify as a disease at that point when so many people have it? This is a legitimate question, one worth talking about. Another question, is ADHD just a form of neurodiversity? Is it actually a disease, or is it just that some people are tall and some people are short and some people have lots of energy and some people have less energy and some people can pay attention for a long time and some people don't? Are we just dealing with one end of neurodiversity? Good question. Something worth addressing. Another question. Is ADHD just what we get when we take all of the children with varying interests, varying skills, different energy levels, attention levels, and then try to get them all to sit in a classroom for 8 hours a day looking at a screen without being able to get up and move around? Is that what ADHD is? Another question worth asking and discussing. And then more modernly, is ADHD what we get when we give children the most addictive machines ever created and hand them to them and then expect the children to regulate themselves? And after watching, I think I said yesterday, a unicorn jumping off of a gecko, it's the most random, bizarre, exciting, and extreme things you could possibly imagine for 9 hours a day on average, and then say, okay, now sit down and listen to a teacher talk about math. Is that what ADHD is? These are all good questions, all things worth addressing. I am going to share, somewhat reluctantly, I actually vacillated on this. There's nothing more annoying than someone that gets up and just talks about themselves. Like, come on, let's get on to something useful. I didn't come here to hear you talk about yourself. That being said, I'm going to talk about myself for a second. And I apologize ahead of time. I don't like doing that, but I think it's going to be useful. So when I was a kid in elementary school and middle school, I didn't know what ADHD was. I didn't have a diagnosis of ADHD, but I really wanted to be a doctor. That's what I wanted to do from the time I was really little. And I wanted to get straight A's. Every year I would write down in my journal. My grandpa kept a journal and I kept a journal, trying to be like him, and I would write down, this year I'm going to get all A's. And every year I would get my textbook and I would get my homework out and I'd get everything down and I would start to study. This is going to be the year that I just knock it out of the ballpark. And I would sit down and for hours I'd sit there with my textbook, rereading paragraphs over and over and over again, and finding that I couldn't get the information into my head. It was like I was throwing mud at a metal fence or something, and nothing stuck. And I get so frustrated. I remember shaking and crying after sitting there for hours trying to study this material. And then, of course, I'd go to class, hopeful that the information somehow got in my head with all the time I spent with it. And I would get F after F after F, class after class after class. And that's how my entire years of schooling went. And there comes a point when something like this happens. I mean, so what does an F mean? It means you failed. To me, it meant you're stupid. That's what it meant. And so every day, all of your teachers are telling you, you are stupid, you are stupid, you are stupid, you are stupid, over and over and over again. That has an impact on somebody after a little while. And when someone asks you, what do you want to be when you grow up? And you say, I want to be a doctor. And they say, oh, you must get really good grades then. Yeah, about that. No, not really. So, there's definitely an impact that happens with kids, and there's something that happened to me with all of that. And at some point, I decided I cannot be a doctor. I am not intelligent enough. It is not something that's ever going to happen to me. So I did not take the SAT or the ACT. Didn't bother. I didn't want someone else telling me that I was stupid, because I knew that I would get far below average grades on it. Every time I went to take a test, I would read the question, and I'd get done with the question. I had no idea what it was asking, and I'd have to read it again. And I'd do that over and over and over again. I'd sit through the entire class period, hardly getting through half the questions, and then I would sit through the next class period after everybody else had already left, and then finally the teacher would say, look, you got to turn in the test now. And I'm still trying to figure out what the questions are asking, and then I would get it back and get an F. And I barely passed all my classes with sometimes D minuses and C's. I thought maybe I can't be a doctor, but maybe I can excel in other areas of my life. So I thought I'll run for senior class president. And I got elected. And I got removed from the position because my grades were so bad. One of my classes, I remember I raised my hand. This was in middle school. I raised my hand. The teacher asked, who conquered the Aztecs or the Mayas? I can't remember anymore. And I raised my hand to give an answer. And I was raising my hand waiting for him to call me. And I don't know, this weird time perception thing happened. And then he called on me. I didn't know how much time had passed exactly. And I said, Pizarro. And he looked at me and he started laughing. He said, Pizarro? You mean Bizarro? And I looked up on the board, and we were talking about English. It was like half an hour had passed. I didn't even realize it. I'd zoned out. And everybody in the classroom started laughing. And then every day after that, when I got to the bus, there was a group of kids that would say, Pizarro, Pizarro, as I got on the bus. That impacts you. And that was just everyday kind of stuff. So now I am a doctor now, so something happened in between there. I'd like to share you a little bit about this. And I shared my experience, not because, oh, the poor, stupid doctor, but to reveal a little bit of what it's like and to answer the question, does it exist? So I ended up getting married in my 20s, and my wife wanted to go to college with me. And so we went to college together. I was a little bit worried about that. I hadn't had very good experiences with school. There was a little bit of trauma there, so I took the easiest classes I possibly could. And then something happened to our lives. My wife got pregnant, and my child was born. That does something to somebody. To me, that did something to me. And I kind of thought, I've always wanted to be a doctor. How am I going to look at my kid and say, hey, you should go for your dreams, when I didn't do that? I wasn't doing that. I was taking the easiest classes I could so that I passed. And I decided I'm going to try to be a doctor. And so I signed up for general chemistry. And I walked in the first day, and the teacher was up there, and I remember he was describing something about the power of, and there's a mathematical thing, and he had like 14 zeros on the board, and he was like getting all animated and drawing it, and I had a panic attack, and I ran out of the class and dropped it. And I got my courage up later, and I ended up taking it. And I studied really, really hard, like all day, 14 hours a day, wake up in the morning, early, study all day. I minimized it down, so I was only taking a couple of credits, and chemistry was one of them. I'm going to pass this class and show that I can do this. And I really tried to learn as best as I could, and I went into the testing center. We had a testing center there where there wasn't a time limit. You could be there as long as you wanted. You could be there 8 hours if you wanted. And I saw the rest of my classmates kind of shuffle in, and they all took their tests, and they were all done within an hour. 7.5 hours later, I turned in my test, and I got it back, and I got like a C. And I knew that I had studied more than anyone else in the class, and I said, something is wrong with me. I need to find out what it is. And so I went to a doctor. Actually, it was a nurse practitioner. And the nurse practitioner asked me a lot of questions, and they said, you have ADHD. Okay. And they said, you might want to try a medication to get some help. Okay, all right. So I was prescribed methylphenidate, and I took it. And at first, it made my heart beat kind of fast, and I felt sort of anxious and sort of sweaty and kind of sick to my stomach, and I said, oh, I hate this stuff. I don't like this at all. And I talked to the doctor about it, or the nurse practitioner, and she said, that will go away. You just take it, keep taking it, unless you can't stand it. Okay, so I took it the next day. And she was right, it went away. It wasn't something that lasted. And I went to go study with methylphenidate pulsing through my veins. I read the material from start to finish clearly, without any interruption. It was like the most amazing thing. Everything I was reading, it just went right into my head. I just understood it. And I went to go to the problem, and I finished all the problems easily. Oh my goodness, this is life-changing. And I went in and took the test. I got the highest grade in the class on the thermodynamics section in general chemistry. I went on to the rest of my classes, continuing in this way, and at 100 credits, I had a 3.96 GPA. And then I ended up taking the MCAT, and I had a 98th percentile score on my reading comprehension section. I wasn't stupid. And all my life, that's exactly how I felt. This was such a life-changing thing. I was older by now. I was 10 years older than all the residents I went to med school with. I went the long route because I thought there was no way I could ever be a doctor. Not in the cards for me. There have been times since then I've dealt with self-doubt and problems. It's hard to get rid of baggage that you carry for that long about yourself. I share all of this for a number of reasons. Hopefully it reveals something about kids with ADHD, a little bit about treatment. And yes, it does exist. It is a real thing, but it doesn't mean that everything we're doing about it is right. It doesn't mean that there aren't more things we can do. It doesn't mean that we need to not change things a bit. This is a complicated and controversial subject. I have patients coming into my office who walk in and they say, well, I Googled all my symptoms online. I have ADHD and I need you to give me 30 milligrams of Adderall 3 times a day. Okay, let's talk about that. ADHD has been popularized in social media. It's all over the place. You can find memes about it. People are starting to use ADHD as an excuse to be lazy. I didn't show up because I have ADHD. Yeah, I didn't do any of my assignments because I have ADHD. And I didn't listen to anything you said because I have ADHD. I'm going to interrupt you and be rude because I have ADHD. That's not acceptable. It's frustrating for people that have ADHD that try very, very hard to then just have somebody blame everything on ADHD. It makes us look bad. Stop it. Not to say that I don't do any of those things myself sometimes. Okay, so moving on here. If you look up the diagnostic criteria for ADHD, you'll find that there's 3 types. They used to have ADHD and they used to have ADD, and since then we've gotten rid of ADD. I didn't make this decision. Someone else did somewhere in an office somewhere. And now they have ADHD and they've got inattentive type, which is what we would have called ADD before, and then we have hyperactive type, and then we have the combined type. And in order to qualify for the symptoms, you have to have had, qualify for the diagnosis, you have to have had symptoms the age of 12 or younger. So if you're like, well, I'm an adult now and I can't pay attention to my job, that doesn't meet criteria for attention deficit hyperactivity disorder. It might be something else going on. So when you look down these criteria, and I do have them, and for some very wise reason, I put them at the end of my lecture, so I'm just going to, I don't want to have to click this a million times, but I'm just going to explain. It uses the word often in there. Often is a very fun word. It's kind of like big or small or strong. It's extremely subjective. What is often exactly? Is that every minute, every hour, every day, every week, every year? It doesn't clarify in there. And then it has a lot of other criteria that frankly is also quite ambiguous and difficult. Something that I think every human experiences at times. And this might be partially why we have problems with maybe overdiagnosing ADHD in some cases and maybe underdiagnosing it in other cases. Maybe there's some work that needs to be done with how we handle the diagnostic criteria. But I think one thing that might be helpful as you approach this and you have patients coming to you, like maybe I do, like I said, saying, I have ADHD and here's what I need, is you can ask questions about how it's impacting their life. So, for example, if someone comes in and they are in college and they're failing classes or they're at risk of failing classes, and you find that they also meet criteria for ADHD, that might be an indication for medication. You find that at their job, they're not able to focus on what they're doing and they're making mistakes frequently despite trying very hard, and they also have symptoms of ADHD, that might be a good indication for you to give them the diagnosis and the and treatment. So the problem we face, though, is that the diagnosis of ADHD, like many arguably all diagnoses, are something we've created. We've looked at people and we find all these data points, and then we kind of group them and we say, okay, I'm going to make a box that says ADHD on it, and I'm just going to put this group of people in that box. And we don't know why do they have these symptoms exactly. We're not sure, there's other factors that need to be investigated. Truth be told, there's actually a lot of things that can cause the symptoms of ADHD. And before you put a little kid on a stimulant or an adult on a stimulant, you really need to dig a little bit first. You need to ask some questions, and you need to sort through the copycats and make sure that you're not giving someone, frankly, an addictive stimulant without working through some of these. And I've encountered all these. So someone comes in, they say, I can't focus, I just can't pay attention to anything, and I just don't feel motivated to do anything. Okay, that could be ADHD. Well, it is ADHD. She's got all the symptoms. I asked all the questions. They answered everything right. But it could be caused by depression. I've had instances where if somebody comes in and I go through the criteria for depression and the criteria for ADHD, and there's a lot of overlap. I say, what if we focused on one thing at a time, and we focused on your depression first, and see if we can get that under control, and then we go back and revisit the ADHD. Explain, because if I try to treat two things at once, sometimes we won't know which one we treated and what the problem was in the first place. So usually they agree to that. A way around that, and I mentioned this later, is sometimes using atomoxetine or Strattera, because it can be effective in treating both. Yesterday I talked about treatment of depression. Make sure, though, that your depression treatment doesn't consist of, oh, you're feeling depression, then I will give you a medication, goodbye. That we're evaluating what else could be causing the depression. Look at the person as a whole person and look at is the way that they're living compatible with even being happy? Next one here is hypomania, and I get this a lot. I have a lot of hypomanic patients, bipolar patients, bipolar 1 or 2. They'll come in, they say, doctor, I've looked it up. I am 100% positive I've got ADHD. I need tons of Adderall. Give me all the Adderall you got. It's not going to be enough because my thoughts are just running through my head so fast I can't even control. I'm like, whoa, okay, you do not need any Adderall. I'm not giving you any. You ask some more questions and you find out, okay, they have a pattern of manic or hypomanic episodes. Don't give them stimulants. And I have patients with mania that come to me, and someone has given them stimulants. And I have to say, I have to take your stimulants away now. And they don't like me. They get mad at me. Don't make me be that person, okay? Another one here is sleep problems. And I run into this one frequently. If you are exhausted, you're going to have a hard time focusing. It's a real thing. There was a study I was looking at with sleep apnea related to this, and I had a case of this, actually. I had a kid come in. Mom said, hey, he's got ADHD. We've got him on meds. I think we need to up his dose. It's not working quite right. And we started talking, and I just said, sleep came up. And so I started asking questions about sleep. Turns out the kid, slept horribly. He's always tired. He's falling asleep in class every day. Come to find out he's a snorer, pretty intense snorer. Come to find out he's waking up multiple times through the night. I said, we need to get you to a sleep specialist. Kid had sleep apnea. Fixed his ADHD. Started sleeping through the night. So don't just jump right to stimulants. Now we could talk about this for hours, this next one here. I'll bring it up because all of us are thinking it, and I mentioned it earlier. The problem is, maybe I'll just take a second, let's talk about this for a second. What do you do about this? This is a serious problem. I bet you, if we were to raise hands, how many run into this with your patients or your patients' children or your grandchildren or your own children or somebody? I think everybody would raise their hand on that. I saw a lot of hands just now. This is a real problem. And it's very difficult to address for a lot of reasons. But I'll tell you something I've started doing with some patients, just to experiment a little bit. I've looked at some research articles. I'll tell you a story. So I had a kid come in who, teenager, mom says he's just doing awful in school. He says he can't pay attention. The kid's like, yeah, I can't pay attention. I just can't stay focused on what the teacher's saying. And, we kind of get through everything. And his grades were suffering, and he was doing poorly, and he had ambitions in life. He wanted to go to college and things like this, and he's like, I'm just not doing good. And I asked the question. I said, how much time a day do you think you spend on social media, on your phone, on screens? And his mom started laughing. Turns out this was a constant point of contention in their home. And mom and son kind of came to a number. It was somewhere around 8 hours a day-ish. He would wake up in the morning. First thing he would do is get out his phone, get on TikTok, and watch videos until the bus came. This is the way he's living his life. He'd get to class, and this is what he's doing every day. So I attempted to be very persuasive with the boy and his mother. And I said, I related some studies that I've looked at. I recommend that you search these. AI is a great way to look for studies. And I I related that there is some data coming out and some theories that are seeming to point to the amount of time that kids spend on screens being related to what almost appears to be brain damage. It's depression, anxiety, and horrific ADHD. And it's thought by many healthcare professionals, and scientists are looking into this, that this may be responsible for these causes, and that if we reduce the amount of time spent on cell phones and on social media, that you may be less depressed, maybe less anxious, and may have less symptoms of ADHD. And I think before putting you onto a controlled substance, a stimulant that is addictive, maybe we should try this first. And I use some other persuasion techniques that I've learned over the years. And we got the kid to agree to it, albeit very reluctantly. He was gravely concerned, and he was watching me. It was almost like, I see what you're about, Dr. Wadsworth. And, but they did it. Mom took the cell phone away. He sincerely, I scared the kid a little bit. The word brain damage kind of scared him a little bit, I think. He reluctantly agreed, but he did it. And I saw him a month later. And I said, well, how did it go? He said, I hated it. He didn't like it at all. I said, well, how is school going for you? He says, I can actually study a lot better now. It's a lot easier for me to pay attention in class. I'm doing better. And his mom says, yeah, he's doing a lot better. We noticed in just a month, he's doing a lot better. And I've done this, I've repeated this with a number of patients, and I've gotten similar results. So, what's going to happen if you go and you say, great, I'm going to do this with every one of my patients? You'll have a conversation with the kid and the mom together, or the dad, whoever's there, and you'll bring up taking the phone away, and the kid will hyperventilate, cling onto the ceiling, his head will start spinning around in circles, and he'll either die or kill someone. One of those two things will happen. I'm exaggerating, but it's really scary, actually. Very concerning how much I've seen. I've had multiple cases of children brought in by police. Police bring them in because the kid has got a knife and he's threatening to kill people or kill himself. In some instances, he has stabbed himself. And then we find out, well, what happened? Why did you have a knife? What was going on? Guess what it was? My mom took my cell phone away. I am not joking. That's becoming one of the more common reasons that kids are being brought in. No joke. This is for real. This is scary stuff, guys. This is very scary. So something needs to change there. That's for sure. Anyway, we could talk about this for a long time. Next one is lack of motivation. Now, this was when the story I told in the beginning about the doctor telling me that ADHD didn't exist, it was just basically lazy people. There are times where people aren't motivated. I remember one instance I had a kid, he just said, he was kind of, what's the word? I don't know, this is derogatory. He was a hick. He was a hick kid. He's like, I like horses and I like this and I don't like math and I don't like English and I don't care and I'm not going to do it and I don't want to study it. And that's just the way it was. And I was like, well, okay, well, I mean, he wasn't motivated. He's like, I don't want to spend my time on that. And he'd say, oh, well, he's got ADHD then. Well, maybe he just wasn't interested in that stuff and he really felt that way. I mean, I hope my kids don't say that. I don't know. But anyway, but that can be a thing. Sometimes it's not ADHD. Sometimes it is just lack of motivation. And it's important to try to, not totally rule that out. The next one is meth addiction. And this is a problem too. There is a street value for Adderall and for methylphenidate. And I have had patients who are abusing it. And they come and they say, I ran out. I need more. Can you get me more? More, doc, I need more. What do you do then? Well, you go through all the questions, yes, to all of them, and, they'll give all the right answers, and how do you handle that? A couple ways. One is it's ultimately still your jurisdiction as the doctor, as a physician, to decide, even if a person gives all the right answers, you don't always have to give them a stimulant anyways, and that's hard sometimes. But one thing you can do too is a urine drug screen. You can do them anytime. And you say, if it comes out with positive for things that they're not prescribed as having, you say, sorry, I can't do that. Another thing you can do is sometimes the long-acting can be a way of handling it, because they want it to get in their system immediately, and if you get long-acting stuff, it doesn't quite do it. Another option is Strattera, which won't have the same kind of effect. So there's still options of things you can do. All right, now, in medicine, we deal with primary prevention and secondary prevention and even tertiary prevention. And we don't think about tertiary prevention very often. That's kind of a weird, fun word to say. But tertiary prevention targets both the clinical and outcome stages of a disease. It is implemented in symptomatic patients and aims to reduce the severity of the disease as well as any associated sequelae. What are some associated sequelae with ADHD? There's a couple. There's a few conditions that kind of go hand in hand with them. One of them is depression. Kids with ADHD are more likely to become depressed. One of them is anxiety. Kids with anxiety are more likely to have anxiety. One of them is oppositional defiant disorder. And people get really upset about this one. I want to dive in for just a second on the psychology of the ADHD person with oppositional defiant disorder. Imagine for a moment that I took you as a child and I brought you out to a room and there was an enormous boulder that weighed 5,000 pounds, and I said, pick up the boulder. And you try and try and try and try. Pick it up, pick it up, pick it up, pick it up every single day, again and again and again and again. How long before you say, screw you, I'm done picking up that boulder. I'm not going to take another second of this. That's kind of what happens with them. Every day, over and over and over and over again, they're told to do things that they try to do and sometimes are virtually impossible for them to do. Sit still in that chair for 8 hours, staring straight ahead as I talk about spam, 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 spam. The kid's like, and they're shaking, and they get up out of their chair, and then now you're in trouble. And after a while, they say, I hate school, I hate teachers, I hate my parents, I hate everything, I'm done. And that's the psychology of a kid with ADHD and oppositional defiant disorder. That's how we create them. So tertiary prevention is, how do we look ahead at a kid who has ADHD, and we help them not to develop oppositional defiant disorder, not to develop depression, not to develop anxiety. And oftentimes, it gets worse. They turn to drugs. And when you already feel like a failure and everybody's calling you a failure, sometimes you turn into a failure. Sometimes that happens. They end up in jail. There's all kinds of other things that happen here. So one thing I try to do whenever I have a kid come in with ADHD is I try to do a little assessment of their self-esteem. We just talk about it a little bit. How do you feel about yourself? Do you feel like you're a smart person? Do you feel good about yourself? And very often I get some pretty low self-esteem that comes out. These kids, the repeated F's for years has weighed on them, and now they've classified themselves as an F. That's what they are. That's how they identify. And I actually wrote a book about this because I wanted to write a book that was the book that I wished that I had when I was a kid with ADHD. And I described a couple of things in there. I made up a story that I tell the little kids. And I say, imagine if you were watching a bunch of fish and a bunch of birds, and you noticed the fish swam really, really well, and a bird went down into the water and tried to swim, and it wasn't as good at swimming. Would you say that's a stupid bird? Would you say that? No, that's not a stupid bird. No, right? It's a bird. It's different. You say, everybody's different. Some people are good at some things, some people are good at different things. And you have ADHD, and that doesn't make you stupid. It means you're a little different. Sort of like a bird. Birds fly really well, and fish, they swim really well. And sometimes in life, being a bird, you are going to be asked to swim. And that's what school is. So you're going to be asked to sit still for a long time. And then you're going to be graded along with the other fish, as if you're a fish too. And you're not going to be quite as good at the swimming as the birds. But that doesn't mean you're stupid, you're just different. However, you've got to try as hard as you can to swim. Don't give up. Because if you can learn how to fly and swim, that is going to give you a really good advantage in life. And don't worry, you won't be quite as good at swimming as the other fish. But any degree that you can learn to swim is going to be of an amazing benefit to you. So don't give up. Because that's a lot of times what they end up doing. They end up giving up. Now, and I don't know if this is totally ethical because we can't confirm that Albert Einstein had ADHD. Goodness gracious, the diagnosis didn't even exist back then and nobody's analyzed him. But I tell them honestly, I say, some people think, that's honest, some people think that maybe even Albert Einstein might have had ADHD. And I'll list a couple other people. And he wasn't stupid. He struggled with apparently math. He tried to get into his master's program in math, and he got rejected. And they have some other things that historians will bring out as to why they think he might have had it. Point is that people with ADHD are not stupid. And so when you go and you try to take your test and you're not doing as well as everybody else, don't compare yourself to them. Just do the best that you can and recognize that you're different, and that's okay. You've got different strengths. So protecting self-esteem is so important. When a kid goes into a school environment and they've got two options on how to view this. Just think of what you would choose if I gave you two options. I said, okay, you can be one of these two things. You can be the person that tries really hard and fails and looks stupid, or you can be the guy that just doesn't really even try. I wasn't even really trying. Got an F on the test? Yeah, I didn't really study. I just don't really care. I just don't really care that much about grades or anything. Which would you choose to be? You're gonna protect your self-esteem. And protecting your self-esteem often can look like, well, it becomes not trying. Why did you do so bad? Because you didn't try. And then, oh, that kid's a bad kid. He's a bad kid, he doesn't even try. And then suddenly, in their attempts to protect their self-esteem, their teachers, they ask them, well, why didn't you do your homework? I don't really care. They'd rather be that than stupid. Which would you choose if you were a little kid? Would you rather be the guy that didn't care or the stupid one? Those are your two options, unless you give them a third option. And you protect their self-esteem. You say, look, you got to try as hard as you can. Try as hard as you can, and you won't get A's. You may end up with D minuses, but trying to lift that rock, even if you can't lift it, will make you stronger. I really feel that today, the reason why I did well in college is because I tried to lift that rock as hard as I could for hours every single day. And I could never lift it until I finally got treatment for it. And then it was like, whoo, So tell them, this is worth effort. This is worth, you're not getting nothing out of this if you don't get the same grades as your peers. Giving them hope stories is helpful too. Sometimes when they're doing really bad. I remember I was at church and this guy was talking about how he did really horrible in when he was in school, all through school, and then he went on to college and he did really well in college. And I remember as a kid hearing that, and I remember thinking, oh, I hope that happens to me. I hope that's what my story ends up being. I hope that I can, even though I'm doing so. And so giving them something to hope for. Say, look, there are lots of really successful, really bright people who have ADHD, got horrible grades. They tried, though. They didn't give up, so don't you give up. They kept on trying, and they tried all the way through, and then they ended up being able to be successful. And giving them kind of a North Star to shoot for. It's important. Tertiary prevention. I think it's also good. There's sort of this theory that some people have come up with that, oh goodness, I think I'm out of time, aren't I? Okay. All right. Well, there might even be some benefits to having ADHD. Someone mentioned earlier, who the heck went out and licked the frog for the first time? I guarantee you he had ADHD, okay? How do we find out which mushrooms are poisonous and which ones are not poisonous? ADHD people, they got it for you. They got your back, right? There is some utility for people being willing to try new things, think outside the box, come up with new things, able to take risks and think in different ways, having difficulty doing the things the exact same way as everybody else. People with ADHD are often our inventors. They're often our explorers, our discoverers. They're the guy that licked the frog for the first time. Anyway, work to protect the self-esteem. This is a complicated topic. There's a million more things I have to say about this. We went too slow, and that's okay. But hopefully this opened up some things, and you can ask some questions. Thank you very much.
Thank you very much. Dr. Wadsworth, please, if you can come up and take a seat for our panel discussion here, our Q&A session. I have a couple of questions already, and we'll get some more here. Okay, thank you. Dr. Wadsworth, do you have a preference for methylphenidate versus amphetamine-based medications for ADHD, and if so, why?
Yes and no. So typically I'll start with it. If a person does meet criteria and there's not other things going on, I usually will start with methylphenidate 5 milligrams. I use usually a variable rate, and I do this for reasons. Some people will get a tiny bit of methylphenidate or a stimulant, and they'll have this massive reaction to it, and they'll feel horrible, and their heart will be racing, and they'll have a panic attack, and they'll go, never using that again. That almost kind of happened to me when I first used it. I was almost like, I'm done, I'm out. And so it's really good idea to start very low on the dosing, but other people will take it, and they'll be like, that did nothing. Like my cup of coffee did more than that. And so I don't know what is the cause of this massive difference in responses to stimulants, but what I'll typically do with someone is I'll say, look, I'm going to give you 5 milligrams. I'm going to tell you, I'm going to put in here 3 times a day, but I want you to just try taking it. You know, if you're kind of sensitive to caffeine, maybe just take half of one of these first of all, and just wait an hour and see how you do. And then if it doesn't do anything for you, then take a little bit more, and then wait an hour. And if that doesn't do anything, maybe try it a little more. And we're going to see each other again in like 2 to 4 weeks, and we're going to readjust your dose according to how you reacted to this initial dose. And then once I get them stabilized on a dose, what I'll do is I'll then talk about using a long-acting release. And then if the methylphenidate's not cutting it for them, Adderall is a little bit stronger, the dextroamphetamine, and we look at other options, kind of go from there. But that's typically where I start. And I don't know if there's necessarily a reason for it. It's just kind of maybe habit, but that's what I do.
Just to follow up on that question too, is there an age where you recommend stopping ADHD medications, specifically if patients have coronary vessel disease?
So before you give somebody a stimulant, you need to make sure that they're not, they don't have any contraindications. So if somebody has like heart problems or they're really unhealthy or heart issues, that could be a contraindication. You definitely always weigh out pros and cons when giving some medication. If somebody has a history of addiction problems, you might not want to go down that route. There are a number of other reasons you could think of for this. But yeah, something that you need to take into consideration. Did I answer the question?
I think so.
Okay, good.
Yeah. Next question is for Dr. Wadsworth. Some family physicians feel uneasy about diagnosing ADHD or feel like they need to refer to someone for testing prior to doing any treatment. How would you ease the mind of family physicians or pediatricians to initiate treatment? And do you have a simple diagnostic criteria you always use rather than just looking at the DSM criteria?
So you can do the Vanderbilt if you're worried about it. Form you send home to the teacher and to the parent, and that's just to make sure that the symptoms are consistent, you know, in multiple environments. I personally, so it was a nurse practitioner that first diagnosed me with ADHD. I think that there is a shortage of psychiatrists, and I think that in order to cover the problem, I think that primary care physicians, nurse practitioners, PAs are going to have to step in and help out there because there's too much need. I want to say too, kind of readdressing the rest. When I asked, did I answer the question? The question was sort of is there a cutoff age for these? I wouldn't say I pay so much attention to the age, but more paying attention to the situation. I do think there's a time where people might need medication at one point in their life and maybe another point in life where they don't need it. If you're not in college, if you change jobs, is not a job that requires you to be very meticulous with details, you're not having problems in your relationships, you've got things kind of figured out, you may not need to be on this medication anymore. So just because someone has ADHD doesn't mean they need to be a stimulant. And just because they were on a stimulant before doesn't mean they need to be a stimulant anymore. So you need to constantly kind of reevaluating, is this really needed? And if it's not needed, they shouldn't be on it. These aren't necessarily healthy to take. This is really a need-based thing.
Okay, thank you. Dr. Wadsworth, from reading, there's about a third of patients with ADHD that also have comorbid diagnosis of dyslexia. Is there a need for testing for this prior to treatment, or what do you do if you assume that someone may also have dyslexia?
That's a really good question. Yeah, you definitely, if somebody comes in, sometimes one of the copycats that I didn't mention on there was dyslexia or learning disabilities in general. Sometimes those can really look a lot like ADHD, and sometimes they can have ADHD and dyslexia, kind of get the double whammy. So getting evaluated, if you suspect it at all, I would really recommend getting a referral to a professional to have them evaluated for that.
Just a follow-up question on ADHD is, there are some more recent medications for ADHD, the ones that have dual release or triple release therapy. How are those benefiting patients, or are they just gimmicks?
That almost feels like a trick question. I haven't used them yet, so I probably should. I think there's probably, what I'd probably do is look up some research articles on them, but I just don't feel like I've had a need to use them. And the reason why I feel like I haven't had a need is because when I prescribe stuff that already has the patent expired for it, it seems to work. So it's like, if this is working, why would I use something that doesn't have it's more expensive. So that's been my experience. I could be wrong. Correct me if anybody has different experience.
Okay, thank you. Dr. Wadsworth, any value in using Provigil or Nuvigil to help with focus or studying?
I haven't used it. I typically always start with methylphenidate, and if it works, or doesn't work, I'll go on to try something else. Usually, by the time I get to Adderall or lisdexamfetamine, if it works, I don't typically go on. There are definitely studies out there showing that it's effective, it's approved. It's just something that's like, if what I'm using works, why would let's experiment with you and try something else. I just haven't done it yet. So good research on it, but it's not something I do.
This is another question for you. It's not necessarily related to the ADHD, but SSRIs can sometimes cause anxiety when starting. Do you have a dosing strategy or a favorite SSRI that you will utilize?
Start low and go slow. That's usually how I do it. So the one that seems to not interact the most with the other ones is usually sertraline. It's a CYP 2D6, which isn't as common as like the 3A4 or the 1A2. It doesn't also have as many problems with breastfeeding or with pregnancy, and so it's just kind of safer to use. Just out of habit, I usually start with 25 milligrams with that. I warn them, hey, you might have a little bit of diarrhea. That's probably going to wear off after about 2 weeks. If the person has real big issues with stopping and starting things, I usually start them on fluoxetine instead. It does have a little bit more interaction with other medications, but because it has a half-life of like 30 days, they don't go through any of those like brain shocks that people sometimes get with those.
Great, thank you.